Hello, I am Dr. Nicholas Ripley from the University of Salford, presenting on the Dynamic Strength Index. So the Dynamic Strength Index is the ratio of peak forces attained in a dynamic and isometric task, commonly using the counter-movement jump and isometric mid-thigh pull. Using the DSI, practitioners can then use that to inform training, so training requirements based on ballistic, balanced or strength emphasis. However, using the peak forces alone offers no reflection of time or an athlete's ability to express force over time, i.e. impulse. So our conventional force-based DSI uses peak propulsion force in the counter-movement jump and the peak absolute force produced in the isometric mid-thigh pull. Heyscher et al. In 2021 published a study on a matched impulse DSI, which considers this time-dependent force expression. However, what about changes over time? A positive outcome of training could be achieving the same jump height over a shorter time period, or that same impulse over a shorter time. So how can we compare these over time if we match impulse DSI? Is a fixed short time impulse DSI more effective? For instance, the 250 millisecond threshold for a fast stretch shortening cycle action. So 38 collegiate team sport athletes performed 3 maximal counter-movement jump and isometric mid-thigh pull efforts on force plates. The force-based dynamic strength index was identified, a fixed impulse DSI using that 250 millisecond threshold, and a matched impulse DSI from using the peak propulsion, matching the peak propulsion duration was utilized. Then using the previously recommended thresholds, these were prescribed training recommendations. If we look at the training recommendations, however, the fixed impulse DSI was significantly greater than the force DSI and the matched impulse DSI, with small effect sizes identified. However, there was a varied response with the training recommendations. So between the force-based DSI and impulse-based DSI, there was approximately a 50% agreement, with an 84% agreement between impulse DSI values. However, there are large intra-individual variations, with individuals going from a strength-based recommendation down to a ballistic-based recommendation, and this should be interrogated further. So a fixed impulse DSI could be used to determine training needs with reflection of time-dependent force expression. However, there are meaningful differences between DSI types, so they should not be compared. The force-based DSI thresholds may not be appropriate for an impulse DSI, so the formation of new thresholds could be required. Thank you for listening. Obrigado.